She's my little sister.
From childhood fun to blogging about their travels, Lexi and her sister are used to doing things together, even having a mastectomy.
I think such a blessing that I had my sister to go through this with me.
Lexi and Ivy never had breast cancer, but their grandmother and 2 aunts did. Their dad underwent BRCA testing, looking for hereditary breast cancer genes. He tested positive.
We were unlucky in that both of us got the 50% of it being positive.
In 2024, Lexi and Ivy, both in their 30s, made a life-changing decision.
We just had the, high percentage of getting cancer in the future, and so taking kind of our futures in our own hands and being able to do it together.
On the same day, both sisters had a preventative mastectomy and reconstruction surgery, but that's when doing things together ended. Lexi's surgery would take one extra step.
I was really lucky in that my insurance covered the resensation.
Resensation is a procedure that reconnects nerves that were cut during a mastectomy and allows the patient to feel again.
Women would like to feel whole after their mastectomy.
Dr. Candace McGuire is the chief of breast surgery at VCU Massey Comprehensive Cancer Center.
I am damaging the nerves inside of the breast, so some of them need to be cut so that I can remove all of the breast tissue. And when you do that, patients generally will experience pretty significant numbness that is permanent.
But women say they weren't prepared for how numb they would feel.
But the resensation procedure potentially restores sensation to the breast tissue. The oncologist and the plastic surgeon work side by side. If a patient like Lexi is eligible and opts to do it, the plastic surgeon steps in to reconnect the nerves during reconstruction.
The graft that we use is like an extension cord, so it spans the distance. And so then using sutures smaller than a human hair, I'll sew those nerves together and carefully place that in, and then we close the skin nicely over.
Resensation is a fairly new procedure. VCU Health is the first academic healthcare system in Virginia to do it. So far, doctors at VCU have done 30 of them. Dr. McGuire says safety is the main reason patients choose resensation.
I call it avoiding the Mrs. Doubtfire moment. So, when you're numb on your reconstruction, you can get burns or damage to your reconstruction.
For Lexi, she wanted to feel the same as before.
It's not 100%, but probably about 75% back to normal. If I, bump into something, I can feel it. Giving people a hug is really nice.
Lexi was a good candidate for resensation because her surgery was preventative. She didn't have to undergo chemo and radiation, which can damage those nerves. If a woman has received those treatments, she may still be a candidate for the procedure. After resensation, it takes about 1.5 to 2 years for the nerves to regenerate and gradually restore feeling to the breast tissue. If you are interested in resensation, talk to your doctor to see if you're eligible. For Buddy Check 6, I'm Reba Hollingsworth.